I have ethical concerns with the practice of a single 200 milligram dose of doxycycline for a tick bite. I'd like to discuss those concerns as part of a common sense Lyme series. I'm Dr. Daniel Cameron. So, welcome to this discussion. Feel free to leave any comments below. I'd like to start with a discussion of a woman who 6 weeks post tick bite came in exhausted, in pain, and brain fog. She had been given a single dose of doxycycline for a tick bite. The tick wasn't engorged. There was a 100 milligrams, 2 pills. That was it. Now, the first ethical misstep that I'd like to discuss is there was false reassurance that that was going to take care of preventing a Lyme disease or a complication of Lyme disease. So let's begin the discussion. I'd like to start with the discussion of autonomy. Patients deserve full disclosure. Informed consent should include the risk of co-infections because a single dose doxycycline doesn't prevent co-infections, and also the single dose of doxycycline has not been shown to prevent anything more than a rash. There's no information that it can prevent chronic manifestations of Lyme or Lyme arthritis. The second ethical concerns non-malfeasance. Do no harm by not dismissing the risk of this tick bite. Now, the false reassurances she got is that she was going to be okay. There was not a discussion of delayed diagnosis and treatment. There was no discussion of whether there was untreated Lyme disease that could lead to chronic or neurologic complications, and also no discussion of that co-infections may worsen or continue if ignored. I have concern with Beneficence, which is the personalized care over protocols. Now, protocols are guides. This protocol of a single dose of doxycycline has been around for some times, but it shouldn't replace clinical judgment. A single dose of doxycycline may prevent a rash, but not later stage Lyme disease. It doesn't treat Babesia, Powassan virus, and other co-infections. It doesn't replace a follow-up care. And so this ethical concern is that personalized care over protocols was overlooked. I was concerned with unequal access and biased dismissal. This is called justice. Now, chronic manifestations of Lyme disease and co-infections were not discussed. No mentioning of different opinions that other doctors don't agree with the single doxycycline dose, which I don't agree with until they come up with better research, and no follow-up was offered. I have several additional concerns that weren't addressed with this woman. She had not been informed that ticks can transmit Babesia, anaplasmosis, and a Powassan virus, as well as others, that standard prophylaxis doesn't treat these pathogens. Patients may think they're protected, but they're not. And in addition, for kids, this protocol doesn't include children under 8 in the research, despite the high risk of exposure. Plus, in children, you may not be able to communicate symptoms clearly, so you may not know if there's chronic manifestations of Lyme disease that might develop. Also, behavioral changes may be hard to recognize in children that I've seen in my practice. They have Lyme disease and they're overlooked. In conclusion, this woman's case brings up various ethical questions that we should be discussing. We must disclose all the risks of this single dose of doxycycline, the risk of late Lyme, the risk of co-infections. Protocols shouldn't replace personalized ethical care. Thank you for joining me for this common sense Lyme series discussion of ethical concerns I have regarding a single 200 milligram dose of doxycycline. If you have concerns or have had problems with a single dose of doxycycline, please leave those in the comments section below. And thank you for joining me.